We do know that it is a novel virus. It's a new virus. And you know, in April when it came out that we had those people in the upper part of the state that were infected with the H1N1, there was a big hullabaloo in the United States as that case in Texas came in. We were seeing more cases show up in other states. We had our own cases going on. And people began to wonder, well, what's the big deal? I heard Rick and Bubba. I like to listen to them, and they were like, you know, why are they going through all this? Why is CDC so excited? The reason for that is that one little word, novel. It's a new virus. Novel means that we've never had this influenza A particular virus circulating in the human population, which means that none of us, therefore, have immunity. So that when one person gets sick, depending on the virulence, how quickly that virus can make someone sick, how much virus it contains in each of its little respiratory droplets, depends on how quickly and how many people and to what degree they're going to get sick. So that's why public health got excited. We have been very fortunate with this novel virus in that its symptoms has mimicked up to this time those of seasonal flu. We're looking to see, CDC is watching, WHO is watching how the Southern Hemisphere deals with that during this time. What happens to it? Does it mutate? Does it become more virulent? Does it become more deadly? If it does, how's it going to affect us when it comes time for us to see it again in the fall? So those are some of the things that they look at. That's why novel virus is so critical. So if anybody says to you, oh, they're getting excited over nothing, you now know why we get excited. We've been very fortunate that this thing has not done what it could do. If people start getting more critically ill with more complications, showing up in the hospital more frequently, with hospitalizations, we know we've got a major, major problem on our hands. That's when the worst case scenario is starting to kick up. Your grocery delivery trucks won't be able to make that run. Your medications may not be as easily available as they have been. Your children's school may need to be shut down. You may not be able to go to work because your daycare is not open. So those are the kinds of things, we start monitoring those things so that we know what this virus, we can anticipate what it's going to do. I can tell you that some of the other initiatives that we're doing through public health preparedness is that we are meeting with the coroners, trying to figure out a plan for mass fatalities. So for our county, there have been 2 confirmed or probable cases in Sumter County. And those are lab confirmed tests. We have a lot of H1N1. We're at a regional level statewide, which means almost all the counties are showing some type of influenza illness in their population because of this novel virus. Typically, we would not be seeing these numbers during July, August. As you know, our flu season usually starts in the fall. But that's as a result of the H1N1. It's mainly from person-to-person transmission, and as Letitia said, sometimes you can get it from touching objects that someone else has contaminated. If she was ill and she came within 6 feet of her, or she handled some of the fomites that she may also have contaminated, then you have exposure. And you need to know the difference between exposure and infection. You may have had potential exposure at that time. The second question was, if that was the case, how long ago did that exposure occur? Was it 10 days or longer? And if so, and the mother-in-law is not sick, then she didn't have a bona fide exposure. They looked at a small group of people who have had H1N1 who then resulted in complications leading to hospitalization. And what are the risk factors that bring those people into that situation? What do they think is the reason for that? And one of the most common risk factors amongst that group was obesity. So this fall, you will get your seasonal flu, 1 shot. Then when the H1N1 vaccine comes out, you'll get an H1N1 if you come in to get that. And then a month later, you'll get your second booster dose, because none of us have the immunity. You've got to have 2 shots of H1N1 vaccine. For little children, say if you're a 9-year-old child who has never had seasonal flu, you will get 2 seasonal flu shots and 2 H1N1 shots. So keep that in mind. If nothing else, get your seasonal flu shot. I know that people say, well, I got it and I got sick anyway. Or the first time I got it, I about died. And my response to them is always, the flu vaccine does not say you're not going to get sick. What it says is, hopefully you won't get sick enough to have complications that put you in the hospital that may lead to death. That's what the vaccine does for you. It doesn't keep you from getting it. So when people say, I thought I was going to die, I say you probably would have if you hadn't had the vaccine. Because you need that protection. I know I hate needles, and that you hear that a lot. I hate needles. Well, you know what? That's why I'm a nurse, because it's more blessed to give than to receive. And Marianne gives me my shot every year, and I want to cry every year, and it doesn't even hurt. We have always recommended that everybody receive their flu shots, seasonal flu shots, everybody. But what we've emphasized is, at a minimum, those high-risk people really need it, those high-risk categories. But a seasonal flu, we always recommend for everyone to take. That Medicare and Medicaid and insurance companies are going to reimburse for the H1N1, which is very helpful, because that means that we can partner with those people to have the vaccine, and they can administer it and get to charge for it. So we will have partners. CDC at the national level is looking at partnering with places like Walmart, CVS, those kinds of things to have it there. So, and again, all this is so uncertain. We don't know what's going to happen, but those are the thought processes that are going on now. Eventually, that vaccine will need to go to the general population. That, in a perfect world, that means that we would vaccinate over 500,000 people in our region. And that is an absolutely overwhelming task. We can only do it with help. Even given other private providers helping us, public health will have not enough resources to vaccinate what it will need to vaccinate should the plan about this vaccine come to be. So let me throw this out to you as we talk about that. DHEC has what we call our volunteer program. It's under the scserve.gov is the website. What that database does is collect a list of names of people, medical and non-medical, who are willing to help us during a disaster or with public health initiatives. It's a stockpile that CDC has that will be sent out to the states. Unfortunately, just like everything else, it probably won't be enough. That's why it's critical for all of us to know what we need to be doing for ourselves and our families.